This is Jay Callahan again, and this is another one of our video mini lectures. In this video I want to talk about early interventions for traumatic stress. So this phrase early interventions is what we find in the literature most recently. There's increased focus on empirical studies these days, and so there's much less theoretical or case examples written about crisis intervention. Still some. And by the way, what is written in that vein, though, is all about traumatic stress. There's really nothing about normative stress. But increasingly, the focus also is on empirical studies. And empirical studies that focus on early intervention, I want to just spend time talking about a couple of them today. This is an exception to my general policy about, your graduate students. You can read the articles that I posted, but I want to spend a little time on these because they're maybe a little more complicated. So in our syllabus, there are 3 examples of studies, research, and interventions that I think we would call crisis intervention, but really they go on the newer terminology, early intervention. So it's really early intervention for traumatic stress or early intervention for PTSD. Okay, so and the 3 articles we have in this week's reading, 2, one's by Rothbaum et al., the other by Price et al., really are the same study, 2 articles written about different aspects of the same study. And then the 3rd article is an entirely separate project by, I guess I got to polish up on my French here. This person is from Montreal, Bousquet de Grolier, maybe, huh? What do you think? A whole separate study. And so to focus on the Rothbaum one first, early intervention was that they were able to get a sample of people between 18 and 65 who came to an ER within 72 hours of having experienced a traumatic event. And that traumatic event was 34% of the time it was rape, 27% of the time it was mugging or some other non-sexual kind of assault, 34% it was a motor vehicle accident, 4% other kind of traumatic event. They had to have the criterion A. They had to have the traumatic event as it's defined at that time in DSM-4. And these people who came to the ER within 72 hours of the traumatic event were randomized into 2 groups. One group, the intervention group, received 3 sessions 1 week apart of an intervention that was a combination, it's CBT, overall, but a combination of modified prolonged exposure. And if you recall, when we talked about in our individual crisis intervention, the problem-solving model, that in that model, the treatment for many of the symptoms of traumatic stress was exposure, was another or a similar form of modified prolonged exposure, in which you would have the person describe the event that happened in the first person in the present tense with their eyes closed as if it was happening right then and there. And as you walk them through it with some reassurance if they need it, you walk them through it multiple times, and then also pick out the most disturbing times, called the hotspots, and repeat them again and again. And it really clearly, and I've done this a number of times, reliably leads to a dramatic reduction in anxiety and distress and upsettedness and things like that. The exposure, the repeated exposure. So this is what they did here, imaginal exposure, that's what that is, and some other CBT things like breathing retraining, exposure, homework, similar thing you do at home, stuff like that. So it was 3 sessions, a week apart. The control group got an assessment only. And what they found was at 4 weeks and also 12 weeks, that the intervention group had fewer trauma symptoms and fewer depressive symptoms, at least at week 4. They didn't measure depression at week 12. And interestingly, the subgroup that had received the greatest benefit were the rape victims. Then the Price study was a further analysis of, other than the rape victims, who benefited most from the intervention. And they looked at several other variables such as cortisol level, heart rate, history of trauma exposure. None of those seemed to make any difference one way or the other about who benefited from the treatment and who didn't. This is all within the treatment group now. Control group is excluded. Within the treatment group, who benefited? The only thing that was significant, which kind of reflects back on our discussion of dissociation earlier. Remember, at one time it was thought that dissociation was a clear-cut marker of who was going to do worst in the long run. And so they did find in this study, the Rothbaum study, the price variation on the Rothbaum study, that the people who had dissociation at the first session were the ones who did more poorly over the 4 weeks or the 12 weeks. All right. Now, if we look at the Bousquet-de Grolier study, also originated in an ER, but when you read more closely, and I hope you will read more closely, yeah, and I guess I should have said, by the way, my little brief description here does not substitute for you reading these studies yourself. Please, you're graduate students, you can do this. This is thick, but, not that hard. In this case, we have 46 people who came to an ER, but not necessarily that they came to the ER for the traumatic event. In fact, they came to an ER for who knows what reason, but if they had a traumatic event within the previous 10 days, then they were approached and asked if they would participate in the study. And if they would, if they fit the criteria, which I didn't put on the slide here, but you can read it in the original article, if they met the criteria to participate, then part of that was to make an appointment with a therapist. And so the first actual treatment session with a therapist took place at least, it was going to be within 21 days to make the appointment, and the average time between the visit to the ER, the recruitment visit to the ER, and then the actual first appointment was 26 days. So you can see this is very different than the other study we looked at. Once again, the people who were included were randomized into two groups. There was a control group, of course, and the treatment group got a different kind of intervention. In this case, although based on CBT, it was a dyadic or conjoint. They use the term dyadic because it's not conjoint necessarily with a romantic partner, but just dyadic. Dyad means two. The focus was on the victim of the traumatic event and one other significant other who could be, it could be a parent, could be a sibling, it could be a romantic partner. But the focus, the sessions, 2 sessions, 2 weeks apart, were focused on building communication between the trauma victim and their significant other. And it included things like psychoeducation, coping skills training, motivational interviewing, but really mostly a way to build the connection, build the support between the trauma victim and their significant other. All right. So it turned out that, remember, 2 sessions, 2 weeks apart, that 3 months later the intervention group had fewer trauma symptoms than the control group. And especially this, at 2 years later, the intervention group had fewer trauma symptoms than the control group. At the 2-year follow-up, out of 26 people who completed the intervention group, none of them met criteria for PTSD. But among the 20 people who completed the control group, they had to show up for subsequent assessments. 5 of them still met criteria for PTSD. So, but once again, the thing here is to remember that this focused on not directly on the trauma symptoms, but indirectly on the trauma symptoms by building communication and support with a significant other. Okay, so these are these 3 articles, 2 different studies really on early intervention. And also for this week, and I'm going to make a separate video, then we're now in a position to compare the different models that we've talked about. The basic individual crisis intervention, the problem-solving model that we focused on. Secondly is critical incident stress debriefing. Third is psychological first aid. And fourth are these new empirical studies called early intervention. Okay, so we'll talk about that next. And I'll see you then.